Hello. So we're going to be discussing the Sinew meridians in this video. In additional videos, we're going to be talking about the primary channels, as well as how to assess each of these meridians for dysfunction to see if whatever is happening for your patients is involving the sinew channels or the primary channels, which then gives us clues as to how to treat them. So the Jingjin, as they're referred to in chapter 13 of the Ling Shu, refers to a network of vessels that has a lot to do with how we move in space with our body, with power and with grace and flexibility. There's a number of ways which Jingjin is translated. Jing is the normal, that sort of like silken thread network, right? Like in the Jing Lo. And then Jin is sometimes translated as tendinomuscular or muscle meridians. I like to refer to them here as sinews because it's really not about like sinews like the tendons themselves, but what influences the abilities for the tendons and the muscles to work in terms of their strength, in terms of their flexibility, right? So the left-hand portion of Jingjin does refer to silk, implying that there's something subtle, something very refined, yet incredibly strong, that can be woven together, right? Just like this warp and weft that constitutes the fabric of our being. And then the right-hand portion of Jing refers, can be understood in a couple of ways. The first is to like pass through, like an underground river passing through the terrain, or similar to the vertical threads in a loom, which I believe is the warp, right? Interestingly, that if you add the disease radical to the right portion of the character for Jing, you get the word for spasm, right? A contraction. So these, as I mentioned, are mentioned in chapter 13 of the Ling Shu, which is the conduits and their sinews, the conduits and their sinews. And so interestingly enough, these are not discussed in the Nanjing, just really in the Ling Shu, as well as a number of other texts that have come after those. So these are said to control the movements of the extremities, which allow us to extend and flex our joints. They allow us to hold our body upright. They do circulate the yang wei qi, so it does protect us to some degree, especially from trauma. And when I say protect us from trauma, I don't mean it's like a shield, obviously, that keeps anything from striking us, but rather something that allows us to heal more quickly from trauma. So for example, like in Chinese medicine, something that you would say, oh yeah, this condition affects the muscles a lot, which would be fibromyalgia, right? That's considered in Chinese medicine to be a condition in which the internal organs are healthy, but the sinew meridians are damaged, as well as, you know, combining some other pathological factors. So it's said that a neurological function of the Jingjin, the sinew meridians, is to control the instinctive reactions of the body, which makes sense because this is about the yang wei qi, right? That circulates around the body and over the body, sort of like clouds that are sort of like hovering over the rivers that are the primary channels. So it's not really accurate to say that the qi flows through the Jingjin, but it's more like the Jingjin circulate qi in a field, like this sort of field of qi that runs sort of like the same sort of like parallel to, but above the level of the primary meridians, okay? So these help us as very yang qi, right, as the wei qi, the outermost layer. This would be that, you know, something's coming toward us like a baseball or a rock or something, and then that allows us to duck, right? We don't have to sit and think about it. We don't have to contemplate it, right? There's no time for that. These are like almost like guard dogs guarding the perimeter of a fence line, right? They just react on instinct, right? And they're very quick, so because it's yang qi, right? So this is an aspect of the qi that moves very quickly, that's more instinctual in nature. But then also there's a quality, since it is nourished with qi and blood, that there may be a quality of muscle memory to it. So for anyone who has studied dance or learned music or practiced martial arts or any kind of athletics, you know, repetition of certain movements sort of allows you to work through a movement or a series of movements that can be quite complicated, especially like in dance, or even like something like what you're doing in driving, especially like driving a stick shift, right? You have to press the gas, press the clutch, move the shifter, right? And there's a certain timing involved in that. There's a certain feel that's involved in that. It's not it's not much of a thought process, right? And it may involve multiple senses, right? Your hearing, your vision, your tactile senses, maybe even maybe even the sense of smell. But this is like allows us to move very quickly, elegantly, and get it into muscle memory through repetition. That's why over time you can tell a lot about the way somebody's sort of meeting the world and interacting with the world by virtue of their posture, their habituated posture, because every day they have a certain mindset, they have a certain attitude, they have a certain reaction to life. And while those reactions are moment to moment and are very quick, but if we're having the same one, if it's stagnating, if we're stuck in that mindset, that belief set, emotional space, psychological space, right, that can affect our posture. And that becomes sort of like stuck in our muscle memory. And that's how, so it may not even be about like, you know, this muscle is weak or these bones are weak or the connective tissue is weak in some way. It's really about our capacity to hold a certain embodied reaction to, again, not thinking, right? This is reflexive reaction to ourselves and the world around us. So Zev Rosenberg has a really nice set of quotes that are in your notes about this. It's pretty interesting. He doesn't talk about it as defensive chi, like Wei Chi is often considered to be defensive, but he talks about it in terms of like offensive chi, in terms of how we kind of like set ourselves up to respond to the world. It's pretty interesting. And that's in your notes. So the Jingjin pathways, again, are relatively superficial, right? They run along, or not run, they circulate across the surface of the body, right? And they deal with the Wei Qi, which is very yang in nature. Therefore, they are very much influenced by environmental and climatic factors. So patients that frequently comment that they can feel the rain coming, you know, they know when the pressure is dropping because they can feel it in their joints, right? This has a lot to do with the sinew channels and how we respond to, you know, changes in barometric pressure, again, which is wind, right? And that's that very much resonates with the wood and the sinews, right? As well as other environmental factors, because it's responding to the environment before we can even think about it. Right. So on a psychological level, consider again how the patient responds and reacts to the world. And when I say respond, I mean like more like a reaction. You know, how do they deal with the exterior? How do they deal with the world around them? And you know, you can look at this in a number of different ways, especially in terms of the 6 divisions, the 6 conformations, right? Taiyang, Yangming, Shaoyang, and so forth, right? So, you know, if we're beginning with the leg Taiyang, right, that's the bladder. That starts about, you know, how do we stand up to the world? How do we stand up to the world and step forward towards something, right? Do we retreat from life? And you think about, you know, the water and the fear, right? Fear contracts, fear goes down and deep and within, just like in wintertime, the earth becomes a seed. All the extraneous life now moves sort of from within, you know, trees and so forth and plants, or goes down under the ground, right? That's where the life is happening now in the seeds or within the trees, within the trunks, right? Within the flora. So that's the leg Taiyang. And then the leg Shaoyang, which is the gallbladder, that's really about like moving, like Jeffrey Yuen talks about, this is like moving our weight to the outer edge of our feet, because that's how we prepare to move in a certain direction. So we've summoned the courage and the desire to extend out into the world. That's Taiyang in general, and we'll talk about this when we talk about evaluation by movements. So I've made the decision to move in a different direction, right? So now I have to decide, well, which way do I go? Do I go that way? Do I go this way? Do I go that way, right? So that's leg Xiaoyang, and again, gallbladder is about decisions. And then the leg Yangming, stomach, this is when we stop to examine our progress. So we've been moving for a little while, right? We've gotten up off the floor, right, out of our bed, and then we've decided to move out into the world. We've decided to go into a certain direction. Then we're going for a little while, and then at some point we stop or pause to examine our progress and direction, right? This is about moving a little bit more physically and metaphorically, moving the weight towards the front of our feet, right? So sometimes we actually need to stop and be still, right? And to kind of feel things out. And then that brings us to the arm Taiyang, which is small intestine, right? That's the arm Taiyang. And this allows us to move our scapula in a way that allows us to reach out, like I'm extending my arm out. You may not be able to see it because my background is blurred. But this is me extending my hand, my arm out by moving the scapula to reach out. And also the sorter is about, what do I pay attention to? What do I focus on? It's not about a decision so much as feeling an intuitive sense, which comes from the heart. Like, where do I want to direct my Shen? What do I want to pay attention to? Okay. Where am I drawn? Even before I make a decision, like, what captures my attention? Where am I drawn to look or to move? Where is my heart guiding me? Right. And then the arm Xiaoyang, right? That is the triple heater. That's about rotating our hand to decide something about what I'm engaging with. And then the arm Yangming, which is large intestine, right? Now, similar to the stomach where we're stopping a movement, right? We're kind of like pausing. Similarly, the arm Taiyang is about grasping something and holding it in front of me so I can examine it, right? I'm holding it, I've got it in my hand, so I'm bearing the weight of it, right? Both figuratively and literally. And then Taiyin, right? Taiyin, both the yang Taiyin, the foot Taiyin, and the arm Taiyin, that would be the spleen and lung. Having a hard time talking, I'm sorry, respectively. That is about retracting and bringing something in close to us, okay? And then the Shaoyin, that refers to, how do I manage what I've got? So I've got a hold of it, I brought it in close, now what do I do with it, right? How do I manage it? And then the Jueyin is about, how do I adapt to changing circumstances? Can I adapt to what I have in the midst of changing circumstances, expectations, disappointments, right? And so when we're later on, when we're evaluating these sinew meridians, like, oh, I wonder if whatever's going on involves one of these channels, we're going to be doing certain movements that mimic what we're talking about, right? And we're going to get more into that in a second, in another recording. So some of the characteristics of the tendinomuscular meridians, the muscle meridians, or the sinew meridians are these. Again, these are located on the surface of the body, and they do move through the muscles and the tendons, and some debate about whether they move through the ligaments or not. And these technically do not connect directly to the internal zongfu, that they can be affected by the zhongqi, they can be affected by the yingqi, and they can be affected by the condition of the internal organs, especially in terms of the internal organ sphere of domain over the substances, right? Because the tendons are going to be nourished by blood, right? They're activated by qi. So obviously the organ systems that have to do with the production of and regulation of blood and qi may have a downstream effect on the sinews, but they're not directly connected like via some route through the fascia of the internal body. They do originate at the extremities, and again, they broadly overlay the primary meridians. And I think of them as sort of like wide bands, which follow the contours of the musculoskeletal system, right? Of the major contours of the bones and the muscles. And they're said to bind at the joints. So if you look in Deadman, Deadman has some nice images of the sinews, and they draw it in that nice pointillist style. And then you'll see these like little black solid areas. And that's where they're binding at the joints, very similar to how the muscles and tendons, or the muscles via the tendons, bind at the joints, right? So you've got a muscle, and then that connects to a tendon, and that connects the muscle to the bone. And then you've got from the bone another tendon, which then leads into that major muscle area, which then leads into another tendon, which then binds it to another bone. So you've got these sort of like, if you think about it, it's almost a little like bamboo, where you've got the regular sort of like core of the bamboo, and then you've got that knot, right, where there's two sort of parts of the bamboo meet. So there's growth, and then it stops for a bit and binds, and then there's another spurt of growth, right? So in a similar way, anatomically, morphologically, the muscles would be like those strands, which in bamboo is very striated, right? So you've got these muscle striations, the muscle fibers, you've got these bamboo fibers, right? Which singly, like individually, are not that tough, but you put a whole bunch of them together, right? They're very tough. And then imagine in the center of the bamboo where there's space, imagine there's a bone there, right? And then where each of these like sort of muscle groups meet is the joints. That's like that knot in the bamboo. And those joints are what allow the bamboo to be flexible, as well as aspects of the striations of the bamboo fibers. So very similar to that in nature. That's one way of thinking about it, right? That it allows us strength, allows us flexibility, allows us stability. All right. So so these move through the muscles, and they also affect the tendons, because the sinew meridians bind at the joints, which are controlled by primarily the tendons. And then at the joints, which hold the bones, one bone to the next bone, are the ligaments, which some could argue really relates more to the water element and the kidneys, because if you've ever seen a ligament, how tough it is, the color it is, sort of the nature of it physically, it seems to have a lot in common with bones, and it is about connecting bone to bone and stability. But then it also overlaps with some capacity to stretch, although not a lot. The ligaments don't stretch a lot. The amount of collagen in a ligament is very limited. So they're meant to stretch a little, but not a whole lot like the tendons, which I think that flexibility, also nourished by blood, sort of links it more or associates it more with the wood. But that's neither here nor there. So the direction of chi flow in all the sinew meridians is from distal to proximal, right? From the extremities up to the center. They begin at the Jingwell points, and then they end at what are called the proximal gathering points. And I'll get to the gathering points in a bit. But these are 4 points that have a lot of influence over the condition and circulation of chi through the various groupings of sinew meridians. And so generally these are used for problems, obviously dealing with the tendons, the muscles, to some degree the ligaments, as well as the subcutaneous tissue and even the skin. So again, these deal with the yang wei qi, which have a lot to do with external pathogenic factors, and all of the EPFs can have some effect on the skin, the subcutaneous tissue, the flexibility and strength of the muscles, and the stability and strength of the tendons. And at the extremities, the qi moving through the sinew meridians becomes much more condensed, and thus affects the yin nutritive qi as well. Therefore, sometimes you could say that treating the sinew meridians can affect psychosomatic pain that's established through muscle memory. So the various indications for the sinew meridians are pretty simple and straightforward. Obviously, anything to deal with the surface is going to have to contend with wind, because wind is the spearhead of all diseases, right? So acute trauma that affects like our muscles, that results in like muscle spasms, right? These are some of the things that you can use Sinew meridians to treat, right? Any kind of trauma where there's some kind of, in a way, like this is like a powerful external pathogenic factor, although it's often assigned to the miscellaneous, neither internal nor external causes of disease. But any kind of acute injury, any kind of trauma that stagnates the circulation of blood or qi at the surface or through the muscles or through the joints can be treated with the Sinew meridians. So twists, falls, aches and pains or stiffness, anything affecting our ability to move smoothly, gracefully, powerfully will involve the Sinew meridians. Feelings of heaviness in the muscles, right? Bruising, edema, especially like from, this swelling and bruising that occurs from some kind of trauma, right? A sprain or a blunt injury, right? Even to some degree, abrasions and burns. And these are most effective, not only effective, but they are most effective in the first, they say like sort of day to 2 days of an acute injury. That's when they really have a very powerful effect on the healing process. But of course, I use them a lot in cases of chronic injury. So, how would you say, well, it's an acute injury? Well, no, it's a chronic injury. Like, how do I decide whether or not to do this, treat the Sinew meridian? We're going to get into that in a successive video as well. But really, I just go by movement. And some of the key signs and symptoms for me are inhibited range of motion, or a sense of stiffness, or any kind of achiness in the muscles or joints that's made worse with some kind of climatic weather-related factor. You can use them also for things like sunburn, fever blisters, cold sores, maybe even to some degree viruses and colds, the flu virus, or wind cold invasion, wind heat invasion, because again, they do affect the yang wei qi. So you can use this when somebody's coming down with a cold, combined with some other therapies, which we'll get to in a separate video when we talk a little bit more about treatment. So that's the basics of the Sinew channels, right? The whats and the whys. And so we'll continue in future videos on talking about assessment as well as treatment.